Good morning, everybody. Welcome again to the last Q&A clinic for PMS of the year. As always, let's start with a couple of housekeeping notes and the agenda. So we will provide you a bit of information about the upcoming events and the documents updates that we have. We will also give you a bit of information of the overview of the known issues that we have and some of the improvements that we are planning to do. And we will finish with the Q&A session, which is the preferred part of the Q&A for you because you are able to ask all the questions that you have. So as always, this session is going to be recorded. We will make it available through the EMA YouTube channel and also on the event webpage. As always, also you will be using a Slido to provide of your questions and also to give the your input. The interaction via Slido is voluntary. You may opt to remain anonymous, but if you choose to use Slido, then you are giving us your consent to process your personal data as it is included in the data protection notice of Slido. A bit of information of the upcoming events. So we know you like this Q&A session, so we have already planned the next year Q&A sessions for SOR, for the PMS and the product UI and the API, and also for XMPD. You have the dates here. The event page are already created, so you can register and block your calendars for the sessions of next year. Also, we have already scheduled the SPOR and XMPD status update webinar. In this case, it's happening on the 28th of January. You also have the event page and the registration is already available if you want to block your calendars for next year. In relation to the document update, so for today, what we want to let you know is that we have created a PMS webinars playlist in our YouTube channel. This way you will have there all the information about the trainings, the webinars that we have done for PMS, for the product UI, and also for the API. So in case you are traveling this during this Christmas and you want to see something instead of watching the series, maybe you can see the PMS webinar playlist. We think it's a good way to have all the information in one place. So in case you need to look for some information, you can do it in this playlist. Additionally, we already did this exercise of letting you know which are the next general issues that we are going to fix. Today, I want to give you a bit more information so you understand what the issues are. We have always talked about these packaged medicinal products that has been transferred in XCVMPD, but today I want to give you an example. Sorry, I need to come back here. So one example is, in some cases, you can see in the product UI that we have 3 packaged medicinal products in your medicinal product. The 3 of them are valid transferred, but you know that you have submitted more EV codes in XCVMPD due to the enrichment of the packages, but those packages are not reflected in the product UI. Why is this happening? Because in PMS, and this is a screenshot from the product UI, under one packaged medicinal product, in this case is the 128, so this one, instead of having one EV code, we have multiple EV codes. These are all the EV codes that you have submitted to XCVMPD to provide all the pack sizes. Due to how the data is handled in XCVMPD, instead of creating different pack sizes, those EV codes are just stored under one packaged medicinal product, and that's why you are not able to see them in the UI. What we are doing with this fix is create a specific packages for those EV codes. The general issue is fixed. We are going to deploy in production now this fix. The only problem, we are ready, but the only problem is that EMA freezes the production environment during the end of the year. So that's why we are not able to promote this fix into the production environment. So this will happen beginning of next year. We will update the FAQ document, and we will also let everybody know that this has been solved, and you will be able to see the new packages coming in the product UI and also through the PMS API for your product. So this is something that we will fix beginning of next year. Additionally, we have the real duplicates that are merged in PMS, and we will use the procedure type. So we will use the procedure type like centralized procedures, MRP, DCP, or national as a new grouping element for to group EV codes in PMS. That will solve some of the issues of these real duplicates, not all of them, but that will help in some cases. And what we will be also doing next year is to remove the duplicated EV codes and duplicated products that we have in PMS. I have just here one example. Here we have two different medicinal products, but we have the same information, so the same full name, authorized dose form, MA holder, MA number, active substance, etc. This is a duplicate that we have in PMS, and we will be working on these duplicates during next quarter, and we will let you know when this is fixed. So you can use these products in the EAF for enrichment and for everything. Also, something that you might be wondering, and for sure it will come in the questions. So now you have the answer here. Is the ATC code report that we have in the product UI? You know that there is an issue. Not all the products that are considered critical are showing in this report. We have identified the reason why we have this bug, and we will be fixing this beginning of next year. And we will take the opportunity to fix it and include the new union list of critical medicines that has been released by EMA on December 12th. This new list has, I think it's around 6 or 7 new ATC codes. It is already published. You can have a look. It's in the link where we have the union list of critical medicines. So this report is going to be fixed beginning of next year with this new list that we make public. So please bear with us. It's going to be fixed very soon. Now, this is time for you to ask your questions. This is the QR code for Slido. You can also use the hashtag PMSQA 1812. So please, log into Slido. We will be this time. Last time we were replying the questions as they were coming. Today, I think we are gonna do again the most voted questions. So please review the questions that are in Slido and upvote them. So we will be replying to them. Now that said, I think Vivian, over to
Yes.
you. You are gonna share.
Perfect. I'll take over. Thank you very much, Marcos. Okay, so you should be seeing my screen, and you should already see quite a few questions coming in. Okay. Okay, there we go. So maybe we can start with this one. Okay, so can you please let us know what the logic for book update of pack size is, as they will be different from different pack, how the pack size will effectively work on it?
Maybe I can take this. So this is the same logic as the bulk update of the manufacturer. So the idea is that imagine you have an MRP and DCP or a DCP. You have 10 products that have the same packages, obviously, because they have been all approved in the same way and the same manufacturers. So when you have submitted all the packages to XCMPD, your products in PMS will have the same number of packages. Now you will go to the product UI, you will choose one of the products in one country, and you will say, okay, these are my manufacturers. And then you will go to the packages and you will say, for this package, this is the package of 10 tablets. The next one is the package of 15 tablets. When you do the bulk update, you will be able to say, okay, for this from this product and this package, that is the package of 12 tablets, please copy the same 12 tablets to this product for a different country, and also for this product of a different country. So you can assign the same structured data, the 12 tablets, to different to all the products of the MRP and the DCP. That is the logic of the bulk update on the pack size.
Okay, perfect. So moving on. Next question. So can you demo bulk removal in PMS PY or give us the steps to follow?
Maybe Marcus, I can take this
Yeah.
one. So, colleagues, at the system demo, we received the same request, and indeed, yesterday we were preparing a use case to demo to showcase this bulk removal update. Unfortunately, the test environment has a bug, and it prevents us to do the demo today. So we apologize. We have alerted the development teams. So we hope for the next one in January we will be able to demo this. In the meanwhile, since we are not able to demo this use case, you can access the navigation guide. I have included indeed the link of the navigation guide, and if you expand the section of product data submission in PUI, and then further reach the submission of multiple products, you can even use the keyword searching removal. You can find a step-by-step to guide you through the action that you need to take for this removal. It's actually 0.6 bulk operation window, and from there you can see the steps to follow. So apologize for that. We will prepare for the next one. Thank you.
Okay, next question. Can you please also provide option of EV codes in search option at PMS PY to check wrong EV code linked to a packaged medicinal product?
So what you can do here, because that is not an option now on the main page of the product UI, but in most of the BI reports, you can filter by EV code. So if you go, for example, to the all packages BI report, there is an option to filter by EV code, and the system will tell you, okay, this EV code is linked to this PMS ID, to this package, all the information. So that would be a workaround to filter by EV code.
Okay, next question. There is still no clarity on the marketing status usage, like never marketed, temporarily unavailable, not marketed, etc. Can you please publish detailed guidelines on this properly? This is not addressed by ServiceNow tickets effectively.
Well, that is not a responsibility of the PMS team. We, first of all, we are not responsible for the marketing status list. That's RMS, and I guess they have the proper definitions of the terms. And also, we are not responsible for the submission of the marketing status. This is done by Iris and by the ESMP team. So I would recommend you, if you don't know how to use the terms, to open a ticket for the ESMP team, not for PMS, because the responsibility, I mean, it's ESMP activities, dealing with the marketing status.
Okay, next question. Define exactly what is different between real duplicates and duplicated products.
Yeah. And so duplicated products are products that, okay, let me share maybe again the slide is going to be easier. Am I sharing? No, I'm not sharing.
Not yet. Okay.
No.
There we go.
Sharing. Yeah. Okay. So A duplicate is a product that shouldn't be duplicated. So in this case, you can see that I have two products in PMS where I have the same full name, the same authorized dose form, the same MA holder, same information. This shouldn't be duplicates. I should only have one medicinal product. The issue is that I have one EV code here and the other EV code is here. For some reason, the system is creating two products where I should have only one medicinal product in PMS. That's a duplicate. A real duplicate is the other way around. I only have one medicinal product, but I should have two. The reason is because in some countries, you can have authorized two products with the same name, same marketing authorization, same active substance, same strength, everything, all the information is the same, but in some cases, the MA number is just different. And that's allowed. The NCA and the country allows you to have two medicinal products authorized, two independent medicinal products, but with all the data is the same. But the system, the way it's built, is creating only one medicinal product where we should have two. That's a real duplicate. Like we should really have two products in PMS instead of one. So this is the difference between a duplicate. We shouldn't have the duplicate, and we will merge these two products, and a real duplicate where we only have one product, but we should have more than one. We should have two. Most of the time is two products. So I hope that is a bit clearer now. This is the difference between both of them.
Okay, let me share my screen again. Perfect. Okay, so next question. Can you please suggest the ways to fetch data from PMS API to verify the PMS PY data?
Well, I'm not sure I am in a position to give you this not to give this information, to provide these suggestions, because I might not have the technical knowledge to do that. So, because if you, I mean, the way I do it is I just go to the API and I just compare field by field. And sometimes it's not very user friendly because I need to compare RMS IDs or SMS IDs. I need to go to SMS or RMS, look for the ID and say, okay, this is film coated tablets, and then go to the UI and see if I also have film coated tablets. That's not very user friendly. If you are consuming data from the API, you should have somehow a system, a RIM system or something that translates what is in this API, and then you can cross-check with the UI. That's the only suggestion that I would really have. Maybe we need to ask also internally to our technical colleagues if there would be maybe something, a different system or something. But yeah, it's very difficult for me to really give you a recommendation on that.
Okay, perfect. So moving on. Okay, there we go. When we withdraw a presentation of a cap in XCV MPD, it is not listed as withdrawn in PMS in 90% of cases. When will this issue be fixed?
So first of all, you need to check if the product in PMS also contains this EV code. So you go to the UI or the API and check if the package is linked to the EV code. If it's linked, then as soon as you perform the update in XCVMPD, it should work. And we have not seen examples like this where withdrawals are not consumed from XCVMPD and reflected in PMS. And I mean, reading here that is happening in 90% of the cases is a bit, we have not seen this. Then if you go to the product UI and you don't see that your product has a link to the EV code, then that's the issue, that your product is not linked to XBMPD, and therefore you can be sending thousands of updates to XBMPD. None of them will be reflected in PMS. So first of all, you need to check if the product is linked to XBMPD, and then also you can open a ticket and we will review.
Okay, perfect. So next question. So, okay, so we have updated the MRP. Okay, I won't read the full full code, but corresponding to two different full names. Should we need to make it specific like that code, or is it okay? Kindly suggest, please.
I don't know now, but by heart, I don't remember by heart. But in the XCVMPD guidance and also in the XCVMPD Q&A document, it is explained how the MRP and DCP numbers should be provided. And if I don't remember, if I remember correctly, you should split the 001 for some products and the 002 for other products, because that depends on the, I think it's on the strength and yeah, the product. So you need to really make it specific, like 001 for some products and 002 for others. If I remember correctly, but again, check the XMPD guidelines. It is explained there.
Perfect. So next question. When is the timelines fix of PAC PMS IDs issues for multiple language countries like Belgium or Finland, I believe?
It has not been prioritized yet, so we don't know. We really need to get rid of the duplicates first. The duplicate products and duplicate pack sizes. That's the first priority, and then we can focus on this issue. Hopefully, it will be done next year in 2026. The thing is, we also need to do the technical analysis on how we are going to resolve this issue. So yeah, most likely it's going to happen next year, but we have not prioritized it yet, so I cannot tell you.
Okay, so next question. In the PLM portal under Spore medicinal products, there are products that appear with a valid authorization status, but they have already been withdrawn. What should we do in this case?
So if those products are yours, then you should check in the products of your organization if they have the status withdrawn. If there is a discrepancy, you can open a ticket. If these products are not yours, you can also open a ticket, and we will check. As far as I know, there is no issue with this report. So we will need to check if it's been refreshed and everything. In principle, it's refreshed every day, every 8 hours. So yeah, if you find any issue, you can open a ticket. Yeah, and we will review it.
Perfect. So moving on. In PMS, for 1 milligrams per 1 milliliter, presentation strength word is mentioned instead of concentration strength. Is this an EMA known issue, or should we need to raise a ticket?
So it is a known issue. It is in the FAQ document of PMS. It is in this document. It already says that this issue has been fixed, and that the action for MA holders is either submit a dummy update to XBMPD. So you choose one of the EV codes of this product, you add a dot in the comment section of the product, and you submit it, and that will force the system to take the correct data for the milligrams and the milliliters. Or you can just wait, and the normal updates of XBMPD, so the life cycle of the product, if, I don't know, next month you need to submit a variation and you will need to update XBMPD, that update will already solve the issue. So yeah, it's explained in the FAQ document.
Perfect. So next question. Can you do a demo of bulk update for pack size enrichment for products with multiple pack sizes?
Um, so I think I could, but now I would need to look for products. I don't know if I have time now to look for this. Maybe this is something that we can do for next Q&A.
Yeah, I was proposing, Marcus, maybe since we have also another use case to show, we can have a dedicated section in January to
Yeah.
showcase those two, use cases.
I mean, it's not that we don't want to do it, it's that we need to spend now finding a product in UAT because we cannot do it in production. In UAT with multiple pack sizes that, create maybe an MRP procedure with multiple products. So I think it's better if, yeah, we prepare and we do it next time.
Okay, perfect. We'll take note of that. For field 1.19, product cross-reference, if a product is authorized under generic, hybrid, similar biological or informed consent, the PMS ID of the innovator product should be provided. What to do if the PMS ID is not available?
So I have a question. I don't know if with this question, what to do if the PMS ID is not available. You are asking what happens if right now is not available in the UI. That's normal. We have not migrated this data I mean, obviously not for non-caps because we don't have this information. And for caps, we've done it for some of them. So if it's not in PMS, it's not an issue. Don't don't create a ticket. It's normal that it's not there. If you are asking in the future, whenever you need to provide this data, what happens if the PMS ID is not available? Then you might need to open a ticket asking, okay, I'm a generic of this product with this MA number or whatever, and we will be able to provide the PMS ID. But right now, not all the products have this information migrated. And if yours doesn't have this information right now, don't open a ticket. It's normal. It's information that shouldn't be there.
Okay, so next question. The logic of MBO did not work for us as it had the concatenation of the all-in-one package for all the packages. Can you please demo of it, pack size book update, as this is not clear in the navigation guide as it will impact MVP updates for ULCM?
So I think again we can demo this next time. What I don't understand is the relation between the MBO and the package, the concatenation of all in one package for all the package. That I would need more information. Remember that you need to split your packages. So if you have a package that says this is the package of 10, 20, 50 tablets because you used to submit the data like this in XMPD, you shouldn't enrich this package. You cannot provide the package size for this because you have multiple there. You first need to go to XMPD, create multiple entries for one entry per pack size, and then only when in PMS you have all the packages, then you can provide information on the pack size. But I'm a bit lost with this MBO.
Maybe they can add some information in the chat. Absolutely. Perfect. Thank you. So can you explain me the difference between the current API industry users and the future public API?
Yes, I can. So right now, when you access to the read API or even the write API, you only have access to your products. You cannot access products of other companies through the API. Also, for your products, you have access to all the information. So if you provide the manufacturers, you have access to this data. If you provide the excipients through XMPD, you have access to this data. You have access to all the data for your products. The rest of the companies don't have access to your data. And also access to this read and write API is only for NCAs and for industry. With the public API, first of all, everybody will have access to this API. So everybody that knows how to call an API. So everybody will have access. Additionally, they will have access only to public data. So, for example, we will remove all the manufacturers, so this information will not be accessible. For the moment, we will also remove the excipients. This information will not be available. There are some fields that we consider or that are considered confidential that will not be available in this public API. So this is the difference, is maybe who has access and to which data they have access.
So next question. What is the deadline for integration of manufacturers MBO and PMS for non-CAP and non-ULCM products?
It's right now what is described, and this information is in chapter 3, is end of 2027, if I'm not mistaken, for products that are not under the union list of critical medicines. If they are under the union list of critical medicines, then it's end of June 2026, next year.
Perfect. So next question. In February, I plan to mass change upload packages to XEV MPD to prepare for the upcoming enrichment. I understand that some of the synchronization issues are not yet solved. Is this too early? Shall I delay?
No. So in theory, all the root cause of this synchronization are now fixed. What we are doing is the products that are affected because of the issues that we had in the past, we are doing data fixes for those products. But for example, this thing on the transferred packages, for new products or new submissions, this issue is not happening anymore. The duplicates, in principle, we have also fixed the issue, or we know what the issue is, so it shouldn't happen. So it should be fine to do these updates. Maybe what I would do is, instead of doing everything the same day or the same week, I would spread a bit the submission in XMPD. So you can do the submission for, I don't know, some products, wait for XMPD to process it, check that in PMS everything has gone as expected, and then continue with another bunch of products, and you can do something like this.
Okay, perfect. So next question. Okay, is it still UNK when PUI will be fully available for updates, also taking into account that the new XEV MPD user interface? Our main issue is wrongly migrated data for CAPS, correct, on XEV MPD. Can we just open tickets?
Okay, so so it is unknown when the UI is going to be fully available for updates, because we first need to decommission XEVMPD to go to the product UI, to move all these processes to the product UI. We don't know when when XEVMPD is going to be decommissioned, so XEVMPD remains there. Then this change on the user interface of XCVMPD, this is to now you will not get you will get rid of this ActiveX. Some companies were blocked and they were not allowed to use this ActiveX, and well, that's why we are doing this minor improvement in the user interface. Then the next question is, wrong data migrated for CAPS, but is correct in XMPD. So again, you can open tickets, give us the PMS ID of the product, the EV codes of your products, and with which data you think is wrong, and we will check.
Okay, so next question. We're still having issues with XCV MPD QC team with product full name being changed by inserting special characters as shown in SPC section 1 when we explicitly indicated not to add those special characters. This creates duplicate PMS IDs.
Um, um, I will need to check with the validation team, but the point is, if the SMPC has those characters, I would like to understand why you said they are not part of the name of the product. Because I can understand why the QC, the validation team is changing what you are submitting, because if it's in the SMPC, it should be part of PM. I'm sorry, if it's in the SMPC, it should be part of XUMPD. Again, we have not changed the business rules of XUMPD. So I would like to understand why, but I will check again with them, and if they see some of these cases, I will ask them to tell me, so I can also review the ticket and review this case.
Okay, so next question. Where in XCV NPD can you add the pack sizes?
So it's really not a specific section. You need to create new inserts. You need to submit new EV codes. There is a webinar called, I don't remember, but if you go to the the PMS playlist in the YouTube channel of EMA, there should be a webinar. I think it's called Manufacturers and Pack Size Submission or something like this. There you have explained how to submit these pack sizes to XCVMPD. But again, it's a normal submission. The same way you are submitting a EV code now to XCVMPD, you need to do it for the pack sizes.
Okay, so do we need to include information about inactive sites if it is showing as inactive in manufacturer information?
Yes. So if inactive means that the organization shows as inactive in OMS, but you have this organization as a current manufacturer in your dossier, then you need to provide this information. Maybe you might need to talk with OMS and ask them why this location or this organization is considered inactive, and they will assess, and you can provide the data to make it active again. But as long as it's an active manufacturer on your dossier, you need to provide this information. Now, if then you have withdrawn this manufacturer or the business operation for this product, then you don't need to provide this information with this initial enrichment in PMS.
Okay, perfect. So when adding pack sizes are added to the existing XCV MPD products using the duplication function, the previous EV code stored in the original entry is not automatically copied for transferred MAs that are duplicated due to the new pack sizes. Is this okay?
I'm not sure this is correct. So if in XCVMPD you take your EV code and you click on duplicate entry, it will also duplicate the previous EV code, as far as I know, because it duplicates everything, including the previous EV code. And it is okay that happens. If the previous EV code is not being duplicated, then I need to check with the XMPD team. But it's very weird that this is not happening. So if you see this, you can open a ticket for XMPD. It will be assigned to the technical team of XMPD, and they will check. But as far as I know, that is not the case. And I will also check after this webinar, so in case I need to check with the technical team of XCMPD.
So next question. Did you just say that the deadlines for the PMS enrichment manufacturer and pack size was extended again, or I misunderstood?
So it has been extended once. So for products under the union list of critical medicines, the deadline is end of June 2026. it was now December 2025. We extended it 6 months to end of June 2026 for products under the union list of critical medicines. For the rest of the products that are not considered critical, the deadline is end of 2027. But again, the timelines, the deadlines are explained in chapter 3. You can go there. In the enrichment section, you have the both dates.
Okay, so next question. We have in PMS the EV codes, but several data are not syncing after an update since October. We open a ticket, but it is not yet resolved. Just the third act saying EMA apt version are inserts.
So that means that we are checking your ticket. Sometimes what we do is we ourselves send a dummy update to the product to check if the sync happens, and that's why you are receiving this third acknowledgement saying that we have updated the version of the product. If it works, then we reply and we say, hey, the issue is fixed and now it's synced. If it doesn't work, then most likely your ticket has been assigned to the development team so they can check why this is not working. So the fact that you are receiving this third acknowledgement means that we are checking your ticket and we are doing something. So you might need to wait a bit until the development team checks why this is not happening.
Okay, so next question. Should we add the national identifiers for all our PRDs, non-CAP and non-ULCM, or only for countries where the national IDs is at packaging level?
Yeah, so again, these national identifiers, not all of so this is not a mandatory field, okay? The package description is optional, but again, it will help you to identify those packages. It will also help NCAs with the mapping they are doing, because they are also mapping what we have in PMS with their national databases. So if you include this national identifier in the package description, it will help. Obviously, it should be done in the countries that provide the MA number at product level, because if an NCA is providing or assigning the same marketing authorization number to all the presentations, to all the packages, then the only way to identify which package is which is with this national identifier. Not all the NCAs are providing this national identifier. So, for example, the Netherlands, they don't provide a national ID per pack size. So for this country, you don't need to provide anything, just a normal package description saying this is my package of 20 tablets in blister alu alu. That would be all. But there are other NCAs, for example, Spain, they give you a national ID per package. So you can provide this information in the package description. So yeah, that's the rationale. Again, in the FAQ document, you have a question explaining this, and you also have a table where we have most of the NCAs and if they have any national identifier, if they provide any national identifier that you can submit in the package description. I would recommend you to have a look at this issue. I mean, at the document and the question.
Okay, so next question. Can you help us with inactive Zentiva location problems? In general, the synchronization between the XCV, MPD, and PMS doesn't work for hundreds of our products. Excipient change, indication change, etc. Thank you in advance.
Yeah, I'm aware of the issues of this company, but the analysis is taking a bit of time. I'll try to have a look, but that will be next year because after tomorrow I'll be on holidays. So It's on my to-do list. I know. So we will take care of this.
Okay. Could you please clarify the deadline for integration of manufacturers for non-CAP and non-ULCM products? Is this end of 2026 or 2027?
Okay, so again, products under the Union list of critical medicines is mid 2026. Products not falling in the Union list of critical medicines is end of 2027.
And colleagues, you can refer to the PMS webpage. There is a section called PMS Roadmap, and there you can find the graphical representation of the extended timelines.
Okay, perfect. Next question. So what role do I need to perform for the required changes in PMS?
The qualified industry user. Check chapter 1. And there you have all the information on how to request the access and which are the privileges and what each user role can do.
Okay, perfect. So next question. Are there any issues with PMS ID on package level? Should we use those products for PLM EIF or not?
I would say it depends on the issue. Like if the package description is not updated or something like this, you can for sure use the product in the EAF. If it's a different issue, yeah, it depends. I would not be able to reply actually. If you think there is an issue, you can also ask the EAF team if they recommend you to use this the EAF or not.
Okay, next question. Is the inclusion of the data carrier identifier a mandatory requirement?
So it is not, but it's highly recommended for non-caps and mainly for those non-caps for which there is an API.
Okay. Oops. Sorry, we just launched the survey. I'm just taking a little bit from the question to let you know exactly that we've launched our survey. Okay.
And yes, please, we are spending a lot of time replying to your questions. We ask you a bit of participation on this survey. We take it into account, your comments. So yeah, if you think there is something that we can improve or something that we should keep doing, please let us know.
Okay, perfect. Okay, there we go. Okay, there we go. So back to the questions. Okay, so why so many tickets are not solved on service desk? Just a general sentence every week.
It's due to capacity. So we are handling the amount of people that are right now dealing with the ServiceNow tickets is not enough. We will improve this next year for sure. We are already training new people to help us with the triage of the ServiceNow tickets, and yeah. So it's a capacity issue.
Maybe I can complement colleagues. I'm trying to address the questions even right. Yes, as Marcos mentioned, we have only one FTE dedicated to these no tickets handling, and this person is able to address 100 tickets per month, but we still have a backlog of 500 plus tickets. So that's why you see things moving slowly. On top of that, we have a quite complex level of data syncs across the whole data flow that we have between PMS, XVMPD, PY, IRIS, and SIAM. So it takes more time to consult all the teams. So multidisciplinary teams consultation is always ongoing. And on top of that, some issues that you have also seen in the FAQ documents, they are in queue for being fixed, but we go based on our priorities. And basically, Marcos, correct me if I'm wrong, but the priority that we assign is always to address the issues that impact the highest number of products first, and then gradually we move towards addressing the rest. So it's a bit complex. That's why we understand the frustration. But please be aware that we are first mitigating the reduced capacity in 26 to onboard new people, one new FTE, and then trying to also speed up a bit the data quality fixes that is required. But we are committed to that. Thank you.
Thank you. Okay, so next question. How to proceed if the MNF of API is not registered in OMS? It cannot be added as MNF in PLM. Can the MEH request to insert other organization in OMS via service desk? Which document is needed as a reference? SEP?
Yeah, so if your manufacturer is not registered in OMS, everybody can create a new organization in OMS. I'm not sure right now which is the documentation you need to provide, but if you go to the sport portal in OMS, there is a guidance on how to open a new change request, to create a new organization, which is the documentation that you need to provide. So please follow the process, and OMS will, if they receive all the information, they will create the manufacturer. And yeah, it's weird that it's not there, because I'm sure that maybe this manufacturer is used by multiple ME holders, or maybe not. I don't know. But yeah, everybody can create organizations in OMS.
Perfect. So next, could you please provide the timelines for fixing duplicates issue? We have a long pending issue. Duplicates PMS IDs created for the same pack size.
Yeah, this duplicates is gonna be done during Q1. So we have different steps and different types of duplicates. We have duplicate CV codes and we have duplicates products. It's not the same issue and it's not the same data fix. So throughout the next quarter, throughout Q1, we are aiming to fix the two scenarios. So I cannot really tell you by when this will be fixed, but it's gonna happen in Q1.
Perfect.
Or
And I
this
just
is the
wanted
plan at least.
Okay, thank you, Marcus. I just wanted to remind everyone we have still a few minutes left. But please make sure to answer our survey, which is just after the Q&A, because it's always really useful for us to always improve our future sessions. So please make sure to answer that. Now we'll get back to the questions now. Thank you. Okay, so on XEV and PT, we have two products, each with its EV code, but in PMS, only one with the two EV codes. Is this correct?
So if in XCMPD these CV codes have the same, well, it depends on the country, but generally, if they have the same active substance, the same strength, the same authorized dose form, the same MA holder, and the same name, then the system will consider this as two EV codes belonging to the same medicinal product in PMS. So that would be correct. Now, if you have a different strength in each of the EV codes, or a different MA holder, or a different, I don't know, active substance, it should be, we should have two different PMS IDs. For this, please check chapter 9 that explains how the data is migrated from XMPD to PMS and how these EV codes are merged or split in PMS. And if you see that there is an issue, you can raise a ticket.
Perfect. So where do I get the EURRD ID to complete the data?
So as far as I know, there is an Excel, a public Excel that you can download.
Yeah, Marcos, I included in the reply the link,
Okay.
and it's where you can find the correct ID for the specific substance.
There you go.
Okay, perfect. Right, I'll move on. Someone is wishing to everyone a Happy New Year. So a Merry Christmas to everyone, of course, and
Same
Happy
to
New Year.
you. I think I speak also on Veronica's behalf. We can't wait to have these holidays. We really deserve to rest a bit. But yeah, we also wish you Merry Christmas, Happy New Year, that you can rest as much as possible. 2026, it will be like, yeah, a lot of changes again, focus on the data quality in PMS. So yeah, it's going to be an exciting year.
Perfect. We still have a few minutes left. So do you confirm that the batch update transfer in PMS tool is used only for ULCM products and not for the non-ULCM products before June 2026?
But you can already use it for your non-ULCM products. You can. I mean, if you have your data and you want to provide it, feel free to send this information. But yeah, for the union list of critical medicines, it's June 2026. I'm gonna ask Veronica, it's that correct, right? Because I see a lot of questions with this deadline.
So if I may, so we clarified for once and for all. I'm opening the roadmap. I included in all the questions the roadmap link. So in order, enrichment of manufacturers' data, structured and structured pack size for non-caps impacted by ULCM list. You can submit this in PUI or API by June 26. So next year, still 6 months to submit this if you have impacted by the ULCM list. And by the way, colleagues, please be aware that there is a new ULCM list been recently published on the EMA website. Then, next deadline, enrichment of structured manufacturers data only for non-caps for the whole portfolio, so all the others that are not impacted by the ULCM list, so that the rest of your portfolio, December 26. This is unchanged. The previous one has been extended instead. Then what has been extended again is the submission of pack size information for the non-caps in XCVMPD and then in PUI, therefore structured also in API if you're using API for the whole portfolio, so the non-impacted by the ULCM list, extended to June 27. And you can find again everything in the PMS webpage. You use the keywords PMS roadmap or simply roadmap, and you can access the graphical view. And yes, it's reported also, as Marcos mentioned, in the chapter 3, but here is more graphical, so it's easier.
Perfect. So have time for one or two questions. So I entered national identifiers, but EMA erased these and sent a third ACK. Why?
Most likely because you submitted this information in the marketing authorization number in XCMPD, and you don't have to provide this information there. It should be provided in the package description. It's very weird that they remove anything from the package description, so that's the only thing that I would imagine. If they have removed it from the package description, then you can open a ticket for the XCMPD team asking them like, hey, you have validated this. I don't agree because of that, and that, and they will revert it back. But if you put it in the MA number, then it's wrong. That's why maybe they have removed it.
Okay. And
I
maybe
see this. I enter it in the package description in the last comment. Then you need to open a ticket for them and telling them, hey, when you validated this, you have removed it from the package description. I will let them know again because they know they shouldn't remove it. So yeah, it's weird. They don't usually do that, but I will write an email to them.
Perfect. And I think we're running out of time. So I will leave it to you to close the session. Thank you, everyone, of course, and Merry Christmas and Happy New Year again.
Yeah, please reply to the survey. And yeah, again, Happy New Year, everybody. See you next year. Yeah, and we will be having these sessions again. So thank you very much.